My daughter actually ended up going to the emergency room for extreme stabbing pains in her abdomen. So, of course, that was very frightening.
We, of course, reacted and ran to what we thought was the in-network hospital in the emergency room out of habit. And then, when we were discharged, when Annie was discharged and wasn't able to keep the medicine down and was still in intense pain, we needed other options.
We contacted our pediatrician for follow-up, and then the doctor called over and asked that she be transferred to St. John's, and they said we shouldn't have any problems then with our insurance picking up the charges. It was comforting to know that we could get her help, get her in the pediatric hospital, and make sure she was going to be taken care of.
And we're, just thrilled to have the experience that we've had at St. John's and have the opportunity to experience St. John's and receive the care that we needed, and finally have a root cause diagnosis and have the choices that parents and patients want.
The doctor let us have a lot of choice in her care, and each time whenever he would give us our options, she would even ask us, is that going to cost a lot of money? And we didn't have to worry about that. I could say, don't worry about it, Annie, the insurance is going to cover it. It's all good. That's why we have insurance. We want to make sure that you're better. We don't want to worry about what it's going to cost.
Having been a product of St. John's growing up, I was thrilled to have the opportunity to bring my child back to St. John's, not realizing that our insurance does cover St. John's and those visits. So we were excited about the opportunity and the experience, and my daughter's on her way to being healthy again, so we're happy about that.
I am practically back to normal. I take my medicine that I was prescribed, and I can, before my diet consisted mostly of chicken broth, which is mostly just salty water, which is not very good, and now I can pretty much eat anything again, so I'm really glad.